What is the state of Black health in America? Getting healthy, cancer, and how to survive. Stay tuned because that's what we're talking about today, coming up next on Community Uplift. Hello, I'm Denise Roberts, and welcome to Community Uplift. According to a recent article by AframNews.com, after 250 years of social segregation and discrimination, current health data confirms that African Americans are the least healthy ethnic group in the United States in a stunning report revealing the state of Black health in 2017. The report is titled Improving the Health of African Americans in the USA, an Overdue Opportunity for Social Justice. It was published in October of 2016 in Public Health Reviews by Biomed Central, and it reveals an extensive research that has not been taken seriously enough and has all but been ignored, buried, hidden, and overlooked in the Black community. Joining me today to talk about Black health issues and ways to overcome them are Tony Lee, the bacillus of the Gamma Pi Qs, Dr. Kevin Ford, who specializes in internal medicine at Doctors Community Hospital, and Dr. Lester Miles, an oncologist at Providence Hospital, and Maya Wright, president and founder of We Can Survive. And first up is Tony Lee, current president of the Prince George's County chapter of Omega Psi Phi Gamma Pi. Thank you for coming back on the show.
My pleasure, Denise.
So Gamma Pi has so many programs within your organization. Where does the issue of health fit into your agenda and the chapter's philosophy?
Health plays a major part in our fraternity. It's one of our mandated programs. Health Initiatives is a primary program within our fraternity. Mm-hmm. As you know, we have a founder, Dr. Oscar James Cooper, who was a physician. He practiced medicine for 50 years in Philadelphia, Pennsylvania. So it's a major part, not only of our chapter, but of our fraternity as a whole.
You know, given the state of health in the Black community, I kind of just want to read you a quote that I want you to respond to. And it says, a goal of Healthy People 2010, which was an initiative, was the elimination of health disparities. It was not achieved for African American people. The current picture, the greatest health disparity between the total U.S. population and ethnic group is found in African Americans. How do you respond to that?
I would say that there is a measure of truth to that, simply because you find, based upon the socioeconomic status of many of our African Americans in low-income areas, they are deprived of health care, health opportunities, because they lack the resources to be able to get the necessary help that they need.
And because of those reasons, and because health issues have become so prevalent in our community, how does Gamma Pi connect with the community on the issues of health?
We connect in a number of ways. We do it through partnerships, through education, through health fairs. We also partner with various organizations such as the American Diabetes Association, the American Red Cross, and we have made it a priority to start young. Through our Q Kids program, we want to make sure that we are educating them young. And then we move on to our seniors through our Senior Bash program that we run here in Prince George's County.
That's really, really very important. And what are some of the ways that you promote or partner on community-wide health initiatives?
Well, we have annual Charles Drew Blood Drive, in which we go out into the community along with the American Red Cross, and we seek donors to donate blood. which is a critical life-saving tool. As you know, Dr. Charles Drew was instrumental in the blood plasma and storing blood, so it's a major part of who we are as a fraternity. In addition to that, we provide bone marrow opportunities for those who would like to become donors. We do swabs, we do things that will help to encourage healthy living as well. We do various workshops on healthy eating with our youth and our seniors.
Okay, where do some of these drives take place?
Well, we've done a number. We do them in Kentland, we've done them in Suitland, we've done them in Forestville. We go throughout the county and we provide it.
Okay, Kentland seems to be one of Cameron 5's favorite places.
Well, it's a community with needs, and so we want to try to do as much as we can to help meet those needs.
So
it's a transforming neighborhood initiative community that allows us to go in and serve them.
Okay, so you go where the need is.
As much as we possibly can.
Okay, and as the bossalist of this chapter, how important, or what's the priority of health education to you personally?
It's as important as the economic situation in our county. It's high on our list of priorities. It's high on my list of priorities because it affords us an opportunity to educate. And your greatest wealth is your health. And so we want to make sure that not only are we trying to establish a healthy county, but we also want to make sure, an economic county, but we want to make sure that we're promoting health as well.
Okay. And I understand you have a number of health professionals in your chapter. What's the profile of medical doctors again?
We have about 5 medical doctors within our chapter. We have about 3 or 4 dentists in our chapter. We have a veterinarian in our chapter. So we have quite a few brothers in that profession who do an outstanding job of serving and educating our brothers as well as our community.
Okay. Let's go back to health education for children. Where do you begin with that?
We start with our Q Kids program. We start them as young as 5 to 7, and we do a number of exercises, education seminars, eating healthy. We take them to various events, and we want to expose them to healthy living and healthy eating.
And these events they take place throughout the year?
All throughout the year.
Okay. Well, listen, I want to thank you so much for being our guest again today.
It is indeed my pleasure.
Okay,
Denise.
it's so
Thank you for having me.
It's so important, and we really appreciate the work you do in your chapter.
Thank you. We appreciate you as well.
Okay. Tony Lee, Prince George's County chapter of Omega Psi Phi, thank you for being on the show today. Don't go away because we will be back with more on Black health issues in America.
One in 6 seniors faces the threat of hunger, and millions more live in isolation.
America, let's do lunch.
Drop off a hot meal and say a quick hello. Volunteer for Meals on Wheels by donating your lunch break at americaletsdolunch.org.
Well, Thomas, you've got prediabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon, too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have prediabetes. Big time.
Welcome back, and thank you for tuning in with us on Community Uplift. Here to talk more about how we can improve health in the African American community is Dr. Kevin Ford, who specializes in internal medicine at Doctors Community Hospital in Lanham, Maryland, and Dr. Lester Miles, an oncologist at Providence Hospital in Washington, D.C. Welcome to you both.
Thank you.
To the show.
Thanks for having us.
So, Dr. Ford, why don't we just start with you? Can you tell us a little bit about your background and how you got into medicine?
Sure. I graduated from Rutgers University undergrad with a Bachelor of Science and went to Howard University Medical School, graduated in 1987. This will be my 30th year out in practice. And so I went and did my residency in internal medicine.
Okay. What made you want to be a doctor?
Well, I had strong family ties. My father is a dentist, and I have two brothers that are physicians, and just kind of hanging out, listening to the table talk, and I was always pretty good in sciences, and so that just kind of spurred my interest.
Okay. And Dr. Lester, how did you get into medicine?
I went to school in New York City. I graduated from Richmond College, and I was working as a lab technician at a company called Charles Pfizer, and there was an intern there during the summer. He just said to me, why don't you go to medical school? And I really hadn't thought about it, but then I decided to pursue it, and I was successful in getting into a medical school. I went to State University of New York, Downstate Medical Center in Brooklyn. Did my internal medicine residency at Howard University Hospital, and did our medical oncology fellowship at the National Cancer Institute in Baltimore, Maryland.
Okay, okay. Dr. Ford, can you tell us about the Charles Drew blood drive? You know, what is it, and when does it happen?
Well, the Charles Drew blood drive is one of our mandated programs for Omega Psi Phi fraternity. And Dr. Drew was one of the initial people who started the Red Cross, American Red Cross, in 1940. And so Dr. Drew was able to take plasma and separate it and be able to store blood. And so that would help save a lot of lives by being able to help people transfuse blood.
Okay, okay. And what's the purpose of this blood drive?
Well, the purpose is to try to get as many units of blood to try to help save lives. We know that every 2 minutes someone is in need of a blood transfusion.
Okay.
And throughout the United States, there's over 10,000 units of blood that are transfused every day. And the only way to get this blood is for people to donate. And so you may have heard there's always a shortage of blood. And so we feel, you know, in Omega that we need to step up to the plate and try to support this endeavor.
Okay, okay. So Dr. Lester, as an oncologist, you've seen cancer up close. What is that picture? What does that look like in the African American community?
It's dismal, only because it hasn't changed much despite the advances that have been made. Most African Americans who present with cancer present at the later stage, probably because they haven't had access to adequate health care, and that's why it's somewhat dismal. But I kind of approach, my philosophy has always been, and this is what I used to tell patients when I was much younger, that sooner or later cancer will become a chronic disease, and I really believe that it's getting to that point. There are so many new drugs that are coming out, so-called immunotherapy, that we are able to treat cancer that previously were untreatable or incurable, and patients getting significant quality of life. So I'm still very hopeful, and I try to convey that hope to my patients, that having a diagnosis of cancer is not really a death sentence, and it will become a chronic disease, I believe, in my lifetime.
What about the rate of cancer in men versus women?
No, I'm not sure about black people, but obviously just the rate of cancer between black and white is certainly different. Can't really say that the rate between men and women are different. Obviously, they get different types of cancer. Men are more likely to get lung and prostate cancer, whereas women are a little more likely to get breast cancer, although lung cancer is now creeping up very quickly in women.
Okay. Let's go back to the blood drive. Do you have a specific goal in mind? You know, what's your achievement? What are you trying to
achieve?
Yeah.
Well, usually the blood drive spans about 6 hours.
Okay.
And we try to, well, the American Red Cross tries to have about 5 people per hour that we sign up. So we usually sign up approximately anywhere from 30 to 35 individuals for the blood drive. And what usually happens, though, there's so many criteria that people have to meet in order to donate blood. We usually end up with about 15 to 17 units of blood. And so, and that's just due to attrition from people not being able to donate. And so our goal usually in that 6 hours, you get about 15, 17 units.
How many times a year do you have this blood drive?
We've done it at least once a year.
Okay.
A couple of years we've done it twice.
And who are you partnering with?
Well, we've partnered in the past with Kentland Community Center.
Okay.
And then I know we've talked about we partner a lot with them in a lot of different programs. So we've partnered with Kentland, and we've also done it by ourselves also.
Okay. And how long has this blood drive been organized by the chapter?
Well, the chapter has been in existence since 1973, and so every year we're mandated through our fraternity to do at least one blood drive a year.
Okay.
So every year we've done it.
Dr. Lester, what do you think the reason is that cancer hits home for the African American community so hard?
I'm not sure what you mean by hitting home.
Well, I mean, why is it so prevalent in the African American community versus other ethnic groups?
Again, I think we just don't have the advantage that other ethnic groups have. I mean, some of it is obviously the scourge of cigarette smoking, the scourge of alcoholism. There's a higher rate of both those diseases in the African American community, and there's obviously a link between that and cancer. There's also a link with some certain cancer with obesity, and that also is a problem in the African American community. So we have those things that other ethnic groups don't have as much of a problem, you know, in terms of obesity, cigarette smoking, and alcohol use. Yeah.
Okay, so I want to read a quote from an article that we talked about earlier in the show. The study that we talked about reveals key factors that affect the overall health care attitude of the community. Improving the health of African Americans is linked to improving the conditions and overall attitudes about our neighborhoods and our living environments. How do you respond to a statement like that? I mean, given that, you know, heart disease, diabetes, obesity, all these different issues, they're more prevalent in the African American community versus other communities.
Well, I think also, I mean, it is more prevalent in it. I guess it just has to do with access of care. Access to care, I'm sorry. This just not, those types of endeavors in terms of health care is not as prevalent in certain neighborhoods. And it's going to be more difficult to find doctors in certain neighborhoods because just of the economics of medicine, how medicine is practiced nowadays.
How about you?
Well, I think also, just like Dr. Miles mentioned, as far as screening, also patients for different cancers.
Okay.
And in our community, we need to get the word out, and that's also part of what the health initiative is about, having these health fairs that we can talk about screening women for breast cancer and when you should get screened, screening for colorectal cancer. And so those are important things that we can do. And in fact, even colorectal cancer, if you get screened early and we take out polyps, we can almost really prevent colorectal cancer.
I'm going to have to cut it right here because we're out of time, but I want to thank you both for coming on the show today.
You're quite welcome.
Thank you. Thanks for having us.
Very good information, and thank you for what you do in our community here in Prince George's County. A real live cancer survivor is in the studio today. When we come back,
I guess sometimes things just happen. Devastating things. It's got nothing to do with fairness. Bam. Your whole world changes in an instant. And you never see it coming. That's what happened to me. The day my mother had a stroke.
I'm Paul George, and I want you to learn the signs of a stroke fast. F-A-S-T.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Because the sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery.
Protect the ones you love.
Spot a stroke. F-A-S-T. Fast.
Welcome back to Community Uplift. Joining me now is Maya Wright, president and founder of We Can Survive. And she has a very compelling story to tell because she is a survivor. Thank you for being here.
Thank you so much for having me.
So can you just share with us, how you discovered that you had cancer?
Okay, so the crazy thing about ovarian cancer is unlike breast cancer where you can do the self-examinations, generally ovarian cancer is diagnosed in the latter stages because the symptoms are asymptomatic with everyday life. So for me, I didn't have any symptoms, went to the doctor, and had routine physical. There was a large amount of protein in my blood work, which was an indicator to my doctor that there was some type of hormonal imbalance of some sort going on. After a biopsy, it was discovered that I had ovarian cancer.
And what were you feeling when you found out?
Okay, so this was in the 90s, and the initial call that I got, that was an issue with my blood work. So in the 90s, the one thing that African American women were afraid of was HIV, not cancer. Nobody really talked about cancer. I didn't have any real knowledge of cancer. So when my doctor said it was stage 1 ovarian cancer and I would be okay, my reaction was actually cool. I was excited not to have HIV, something that, we talked about, versus cancer, something that we didn't talk about. Not saying that people didn't die from cancer in the 90s, but generally it was like a secret. Auntie was just sick. That member at church was just sick. Nobody talked about cancer.
Okay, and so but you're a survivor.
I am a survivor.
Okay, so what was your experience like?
Like I said, my initial diagnosis, I was 23 years old, several weeks of radiation, and I was fine. Reoccurrence came back in 2007. I think it was more horrific hearing that my cancer came back than anything. Because like I said, my doctor said everything was going to be okay. No one told me that ovarian cancer was like the #1 gynecologic killer cancer amongst women, that 75% of women diagnosed with ovarian cancer don't make it. So I think the facts are some of the things that scared me. After chemo and radiation the second time around, I was fine. It wasn't until my third reoccurrence that things became scary. I would finally have my ovary and fallopian tube removed. After several failed attempts of radiation, chemo, a chemo cocktail, I was deemed terminal because nothing was working.
But you survived.
I survived. I was blessed to be able to participate in a clinical trial for a drug called Avastin that eventually saved my life.
Wow, that's amazing. And you're truly blessed.
Yes.
The world is truly blessed, obviously, to have you here now. I'm so happy that you're here with me right now. So now you have, fast forwarding to today, you've started a nonprofit.
Yes.
Tell me about that.
Okay, so We Can Survive. We are a cancer awareness, patient advocacy, 501c3 nonprofit organization in PG County, where we physically, spiritually, and financially, more on the financial side, assist cancer patients and survivors. But not just the cancer patient and survivor, the caregiver, because if your mom is diagnosed, dad, husband, children, you're affected as well as families impacted by cancer. We do everything from making sure that our cancer heroes get to and from cancer treatment, paying for co-payments that can be extremely expensive, making sure homes are clean, that there's groceries in the house, to paying for delinquent rent and mortgages, because when you're sick you can't work. If you can't work, you can't pay your bills. As well as paying for funerals for persons that don't have life insurance, or in some cases when the life insurance company decides to contest a policy of a person who has cancer, or the policy is under 5 years, and anything in between.
Wow. You must be able to help a lot of families.
Yeah. To date, we have assisted 94 families.
Wow. Okay. That's great. That's great. What made you want to start that nonprofit?
For me, I wanted to be able to give back to individuals that are cancer patients and survivors in a way that wasn't afforded to me. I had an amazing job, and when I got sick, I was not supported properly. And I think a lot of times people assume that cancer patients and survivors are heavily supported by the community. So I wanted to be able to assist that cancer patient with their co-payments, because I know what it's like when you're going to radiation every day and you have a co-payment. While it might be $5 or $20, if you're paying $20 every day for several weeks, that adds up, especially if you're unable to work.
Sure.
I know what it's like to be sick and you have visitors coming over and you're too weak to clean up. Or just basic things like groceries and utilities. You're deciding, you know, hey, am I gonna pay, you know, my mortgage with the little bit that I have saved, or am I gonna provide food for my family?
So how are you able to raise money?
Well,
for your program?
What we do is we depend heavily on the community and fundraising. We do